On today's Two on Your Side Town Hall, there is more hope in the fight against COVID-19. A long-awaited third vaccine appears to protect against the virus with just one shot. We're going to be taking some of your vaccine questions to an expert.
And you also asked about the news from General Motors this week that it's planning on going completely electric. So what does that mean for the Tonawanda plant and the 1,500 people who work there?
And we had some technical difficulties yesterday, but today we are ready to talk about your taxes and the changes sparked by the pandemic. An expert will join us to iron out some of the wrinkles that you may encounter when filing this year.
Yeah, fingers crossed, but we're going to get a forecast update to start today.
Yeah, because meteorologist Heather Waldman joins us. You have the right picture beside you there, kind of a frigid look to it. There it is.
Yeah, sorry. I'm not used to being in the studio, in case you can't tell. Anyway, yeah, we've said it a few times already this week. It's cold outside, but this is when we expect it to be cold outside. The thing is, it hadn't been for the last few weeks. Here's a look at the numbers across western New York right now. It's 20 degrees in Buffalo. It certainly doesn't feel that quote-unquote warm thanks to that northwesterly breeze. It's not all that strong, but I tell you what, if you're facing the wind, you know it. 14 right now in Olean and in Wellsville, 15 in Rochester, 24 degrees in Dunkirk, and 27 degrees in Erie. By the way, Lake Erie's temperature is still hovering at 33 degrees on our end. A little bit of ice starting to build on the western end of the lake. Wind chills showing close to zero in Franklinville and Wellsville. A little bit better if you are closer to the water with, again, water temperatures in the mid-30s. It kind of buffers things just a little bit. Satellite picture shows a few light little snow showers. We've kind of been in and out of the snowflakes over the last, 24 hours or so in downtown Buffalo. Additional snowfall, guys, maybe an inch tops by the time we get to tomorrow morning. When it comes to the weekend, the cold will slowly ease. I'll be back with a more detailed look at the forecast in a few minutes.
All right, more to come.
See you in just a bit. Hey, Heather, thank you very much. We want to begin today's town hall with some hopeful news as we got an update today on a third potential vaccine, this one from Johnson & Johnson.
Yeah, and here's what you need to know about it and how it compares to those made by Moderna and Pfizer. The Johnson & Johnson vaccine requires one shot, while Moderna and Pfizer require two. Johnson & Johnson says its vaccine is 66% effective at preventing moderate to severe COVID-19 illness and 85% effectiveness at preventing the most serious symptoms.
So compare that to the Moderna vaccine. It is about 94% effective at preventing those mild to severe symptoms. And then Pfizer's vaccine is pretty close to that, 95% effective. Again, both of those require those two shots. Johnson & Johnson still needs to get the green light from the government before it can begin shipping out vaccines.
This is a single shot vaccine in which you start to see efficacy anywhere from 7 to 10 days following the first and only shot.
And joining us live to talk about it is Dr. John Selleck, an epidemiologist and infectious disease expert with Kaleida Health, UB, and the local VA hospital. Dr. Selleck, very glad to have you back, and thank you for being here tonight.
Thank you for having me. Good to see you guys again.
Good to see you, doctor. So Johnson & Johnson's vaccine, again, it is a one and done, a single dose, and it can survive up to 3 months in an ordinary refrigerator. There are cooling issues with the other one. So those are the big selling points, but also some concerns with this particular vaccine, specifically how effective it is, and especially in terms of these new variants that we're hearing so much about. So the efficacy was 72% at a trial here in the U.S., but only 57% in South Africa. So people have probably heard about that South African variant. So how concerned are you about that part of all of this? And what are your thoughts generally about this Johnson & Johnson vaccine?
Well, I think this is all very interesting. If you look back to last fall and we were talking about vaccines and how quickly they would come out, and you saw all of our major players, Dr. Fauci, Dr. Joss, saying that they'd be very happy if we had a 70% effective vaccine. And then all of a sudden we have the BioNTech, Pfizer, and Moderna vaccines that are in the 90s, and one study from Israel now showing that the Pfizer vaccine is even much higher than the mid-90s. So we're starting to compare these against one another based on these percentages. And I have to point out that most of what we're getting is from press releases. We've not really seen any of this published in the medical literature yet or presented to the FDA where we can actually see the numbers. I think that, it's going to be wonderful if we have a choice of vaccines, as we've seen some difficulties with getting vaccines rolled out. And particularly for doctors' offices, more rural areas, having vaccines that don't require a real deep freeze would be a big benefit. We're going to continue to deal with these variants. This is the nature of these small RNA viruses like the coronavirus. The more we play with them, the more they mutate to try to get around what we're trying to do. So we don't really have a whole lot of data yet. Pretty much everyone is saying that their vaccines work reasonably well against the B117 variant, which is the one from the UK. We don't have as much data on the B1351 variant from South Africa, which is a little bit more ominous. So we're going to have to wait and see exactly what comes out with these. But obviously the J&J vaccine and the Novavax vaccine both showed relatively similar efficacy in South Africa and is lower than what we've seen in the other places. So whether this is going to require a modification in the vaccine, we will probably figure out over the course of the next weeks and months.
We're curious about how this might work. If it does get approval, Johnson & Johnson is due to deliver 100 million doses to the U.S. government by the end of June. And since you just need that one dose, that's 100 million people. If we add in that supply, could we reach that herd immunity level in this country by early summer?
I think that's a real possibility. And again, it's going to depend a lot on what happens with these variants and how well it works against the variants. And as you probably saw, the South African, the B1351 variant has been found in South Carolina in people who have not been to South Africa. So suggesting that we do have some spread of that already in the United States. So it will depend. We don't know exactly what that magic number is for the population-based immunity. It's easy to do the math, but you have to make certain assumptions to do the math, and that is how readily these different strains spread. Because if we wind up with strains that spread much more easily, then we're going to need a higher percentage of the population immunized. But clearly, it's tough to tell exactly by what date it would happen. But the more people that we get vaccinated, and if this single-dose vaccine does maintain its efficacy in the United States, that would be a huge benefit.
Yeah, 100 million additional people in a not too long period of time. So just to keep everybody kind of clear through all this, so we've talked about Pfizer and Moderna and Johnson & Johnson, the new news today. You just mentioned a moment ago Novavax. That one we got some news on yesterday. It appears to be safe and pretty effective. What should we know about that vaccine and how quickly it might be able to get into people's arms?
Again, I don't know the precise schedule. One of the key players was on one of the podcasts last week or the week before, saying that there are no scheduled FDA meetings through the month of January, which means that we're probably looking at February at the earliest, and that's presuming that the company would get the information together and get it to the FDA. And as I said in the beginning, I don't want to throw cold water on anything, but we'd really like to see the data. The press releases are great, but nothing makes it like the data. And understanding exactly what we have is going to be important. Again, what Novavax showed in their UK study was about 89% efficacy, but that same 60% or so in the part of their study that they did in South Africa. So there's a bunch of things going on here that we're going to have to get a look at.
Yeah, and you talk about the data and just how important that is. And I know that as soon as it comes out, a lot of people like you, Dr. Selleck, will be pouring through it and seeing what we can learn. Thanks so much for sharing some of your time with us this evening.
Great to be with you.
Good to see you.
Thanks again. And another question that we've gotten lately amid news of more vaccines becoming available is, should people wait to get the vaccine of their choice, or should everybody just get whatever vaccine is available to them first?
It is an important question, and it's one that people are asking, and we got an answer to it today from a pretty good expert, Dr. John Brooks. He is Chief Medical Officer of the CDC's COVID-19 response team. Listen to him.
Any vaccine is better than no vaccine as long as it meets the standards required under the EUA. And in the event that you have the choice to be vaccinated, I'd encourage you to take the vaccine that you're given, as long as it meets the requirement under the FDA's emergency use authorization.
I'm glad we got this question answered because we have gotten it so many times.
Yeah, I mean, just personally, I mean, you think about it, as soon as one's available, get it. And if for some reason they can improve it, I mean, there are trials that are ongoing for a lot of these vaccines. Can they make any minor adjustments and make them even more efficacious, or even, make little tweaks to them? But if you have a chance to get any vaccine, I wouldn't pass up on one.
Yep, now you know, take that chance.